Alex did a great job of setting it out very concretely and abstract in a way as well in terms of a UN agency. And so I'm going to get a little more specific in terms of UNICEF. Partly that is because in UNICEF there's as much internal advocacy as there is external. And so the more I say this publicly, the more it's indelible and there's no going back for the organization. And I'll explain a little more of that as I walk through this presentation. And apologies to Maha in the back, as you've seen some of this already as we were together in Japan. And what I thought I would do, because there is so much excitement about this report we just put out, is just give you a little flavor of it by way of kicking this off. And then I'm going to shift over to an initiative that was launched by our executive director a year and a half ago now, which is another example of a sort of a cementing something in the institution. And then the third part of this, I'm going to walk through the solutions piece, and again, just to give you a sense of the directions this agency is moving in, talk a little bit about some future directions. So you'll get a sense of what your UNICEF is going to be doing, and not just because I've said it, but because we operate in a slightly different way than WHO insofar as we have an executive board that governs us, that meets 4 times a year. But they don't pass resolutions. They approve board documents and country program documents and policy documents. They are our policy-making body, and they are 120% behind what I'm about to talk to you about this afternoon. And I think I'm not going to go from my notes, just in the interest of time. I think this will be more efficient. So this is the document that came out almost 2 weeks ago now. It had unprecedented in UNICEF's history. And a place I've spent the last 25 years of my life, had unprecedented pickup, media, social media, off the charts, quite extraordinary. And we're not surprised when I get to the End Violence Initiative, you'll see similar reaction from the general public, and a huge reaction in social media, which I attribute to the millennials and their interest in this issue, because it's certainly not my mom who's on Facebook and tweeting, a much younger group, very, very interested in and I think committed to these topical issues. So I'll run you through 7 of the big sort of facts out of this report. And if I can just say one more thing about this, and Alex, sorry, just to diverge a little bit from what you said, UNICEF's actually been working on this stuff for the last 3 decades, but never in plain sight, never really articulating a position as vocally as we are now and as our current executive director is. So we're really excited about where we are right now. But we've been collecting and putting out data, but never all together in one place. And the unique feature of this thing is it covers 190 countries. And everything else that we publish is usually the North looking at the South. And in fact, this is saying, hey, we've got a global problem here. We're all tied in this issue. So the first fact is that violence is the leading cause of injuries and death among children. And I'll show you a couple things here. I mean, a lot of this data won't be new to the people who are sitting in this room or at this conference, but we had an instant visit from the Brazilian ambassador to the UN the day before the report came out, very unhappy in an election year with what the data say about Brazil, and similar reactions from other countries questioning the sources of the data and so on. But in any event, I think the key finding here, and not new to us, but very topical in the United States right now, with large numbers of unaccompanied minors coming to the United States from Central America. So this data resonates. The second thing, as I said in Japan, Maha, the place where children are most supposed to feel safe and secure, they're actually not. The most common forms of violence against children occur at home. This is data on violent discipline. And I'm not going to, you can pick up the report or I'll go online and give you the link, so I won't stay too long on these slides. But and this is a slide which I think is pretty arresting, showing that over 40% of children in these 3 countries in particular are experiencing severe physical punishment. And most of the media that I personally did in the 48 hours after the release of this report was responding to this 2 questions, as you are now too, Mike, about what is violent discipline, what is corporal punishment, you know, when it's just a slap, okay? And So it's really charged, I think, quite a lot of public discourse around this, a quite topical case, well, two of them in the United States right now. The latter, I'm intrigued by to see where it goes in terms of its influence with the football player, American football player, and the violent disciplining of his 4-year-old to the point where the child is presented to health services. And I think that stands the opportunity to actually trigger even more public discourse, and one would hope some social change. The third big fact here is around bullying, physical fights, and physical attacks. And much more common or commonly reported in Europe and North America. And yeah, this is the one area of the report that really ties in high-income countries as well as low and middle-income countries. And this was headlines all over the place for at least 12 hours after the report came out, but the high numbers of girls subjected to forced sexual intercourse, etc. So sexual violence being a major issue, in particular for adolescent girls. We know it's a driver of HIV and AIDS, so there's some important work to be done there as we work on violence prevention as relates to sexual violence. One of the things I think that's really important, and as you pointed out, Patricia, the worlds of the GBV worlds and the sexual violence and conflict worlds beginning to speak to the rest of what's going on in terms of violence prevention. And our key mantra here is that we need to privilege much more our attention also to sexual violence in boys. And you don't hear much about it. Legal frameworks, policy frameworks internationally are pretty weak, in particular in South Asia, in the protection of boys as well as girls. I think many of you know the history of all of that. Importantly, there's a bit of data in here that looks at the linkages between child marriage and sexual violence and other forms of violence. It's unsurprising, but at least it's finally stated what the links are. We're very careful when we work on child marriage, depending on which community you're in, whether you characterize it as violence or not, but we know that the outcomes for girls are violent, even though families, in some cases, see child marriage as a protective mechanism and a social norm. And this fact just that most victims never disclose their experiences. If they do tell someone, they tend to tell a peer, and certainly don't seek help. Lots of reasons for that. Time's too short, and that's not really what this presentation's about. So let me just stop with this one. Condoning practices and social norms place children at risk. And this is a big area of work for UNICEF, and we're heightening our work both on FGMC, female genital mutilation and cutting, as well as child marriage. And that's, again, we don't necessarily characterize female genital mutilation and cutting as violence, depending on the audience we're sitting with, even though we know the outcomes are negative and related to gendered norms and other discrimination. This is really interesting, and it also applies to the violent discipline work. You see here that on the right in the box, over 80% of girls in these countries think wife beating can be justified under certain circumstances. We saw this in your slides yesterday too. And it's the slide, another slide we have on violent discipline shows that most of the caregivers who are using violent discipline don't actually think they should or need to, but they're still doing it. So we really have to ask ourselves questions about what's driving that behavior. And I think if we can answer some of those questions, then here you go. I think if we can answer some of those questions, we can tailor our interventions much more effectively. That's just to underscore the point made earlier. Okay, so I told this anecdote in Japan, so Maha, bear with me, but how UNICEF repositioned itself, sharpened its focus on violence is partly because of the foundations who created a space to provide external pressure on our organization. You might not have called it pressure, but we were certainly, we certainly felt like at higher levels that there was a push pressure on Mr. Lake. But I think it was a combination of that. I'd like to say it was some of my own persuasion, but also the events of the world. And I've been personally reflecting on this a lot, that when Tony Lake called me on December 24th, 2012, I was wrapping my last few Christmas presents thinking I'd escaped the office, but you can tell when he's calling it, it comes through a particular part of UNICEF where you just take the call because you know it's either you're going somewhere there's an emergency or it's Mr. Lake. And he called and he said, he was quite frazzled, and he said, we're just not doing enough to protect children from violence. And I attribute that to the fact that we had just witnessed, Malala had been shot, there were the gang rapes in India, the ongoing situation in Syria, the Russian government damning those children in institutions who were destined to be adopted in the U.S., that over this political thing they were going to be staying, and then the massacre in Newtown. And he grew up about 10 minutes from there. And so this was the beginning of UNICEF upping its game on violence against children, of all things, if you can imagine. And it speaks, I think, to some research that Fenton Communications did, went around the world, interviewed elites, interviewed people in positions of power and so on. And they didn't understand child protection, but they understood violence and were passionate about it and had a personal story. So anyway, I wanted to show you this. Unlike any initiative UNICEF has ever in its, however old we are now, 70 years old, 65 years old, nothing has ever had this kind of impact. And it's a global and local initiative wherein it provides a framework for communication and advocacy at the highest level in a country or internationally, but at a local level creates a platform for very good programs, the work of NGOs and so on. So I'll just show you this. I don't really know how I'm going to do that. So there's more and more of this. I'm going to just skip over it because I think that we don't have a lot of time. It essentially went viral, and it's in over 65 countries now. And it didn't start programming. Things were already going on, but it sort of shone a spotlight on them and made it, I think because UNICEF spoke out the way it did, and Tony Lake putting himself out as well, it sort of legitimized conversation around this. I think, as you said, could be a difficult subject. Anyway, it's catapulted resources, and by the way, the $4.5 billion doesn't come to protection, I assure you. We're at about 8% of that, but in 150 countries. So we also listened to Fenton Communications when they said, yes, the data, show all of that, that's really important, but you really need to talk about what works. And so together with the data-driven report, we put out this 6 strategies for action. On the Ellen show, I was going to have one under all of your seats, but we didn't have enough. So I won't, I don't want to, there they are, I won't talk about them. I want to get you to my final sort of couple of words here about moving forward, and you can't see one anyway. We chose examples that were evaluated and effective. And I think that the big challenge here is a lack of comprehensive baseline and evaluation data, something that I think we're all going to try to get better at. Snapshot of the case studies that we looked at, truly global, some South-South collaboration, North-South sharing too of experiences. I know there are people in the room that are doing that as well. More of the case studies. You can take the books and have a closer look. So here's where we're going and what I want to conclude with. The way we operate, similar to the cycles of governments who have their financial planning cycles, and so we go through now, we're now into our 2014 to 2017 strategic plan, which gets approved by the board. It has a robust monitoring and evaluation framework with indicators at the outcome output level. And our strategic plan has a key result area for violence. Violence, exploitation, abuse, and neglect, but violence is the chapeau for all of the work. And it's necessarily intersectoral, so our ECD colleagues, our health colleagues, not so much our water colleagues, our education colleagues, there's a lot of intersectoral work in the indicator framework, and certainly that's the way it's going to play out as we move forward. We have 4 sort of key areas that we're advancing: violence in all contexts, including gender-based violence in conflict. The second work stream is on civil registration and vital statistics, in particular birth registration. A third on FGMC and child marriage, and a fourth that is all of our children in conflict agenda. So that's one thing. So you're going to see sort of big activity, and funding is strangely pouring in for the first time in my life in UNICEF. The second, and you've heard a little bit about no violence already, this is the Global Learning Initiative housed in India. We're going to continue to support that and play a behind-the-scenes role in what is truly a global learning initiative on violence prevention in children. The third work stream, and this is partly, again, to raise the profile of both the sector and the work on violence and exploitation, is the global development of master's concentration in child protection. We have an international advisory group, which is chaired by Julio Frank at the Harvard School of Public Health. And we have scholars from India, Mexico, South Africa, Ethiopia, and Scotland on that advisory group. And the idea is that we grow the interdisciplinary discipline in different schools. It's not in public health everywhere. It's in law in some places, social work in other places, et cetera. And then finally, and this is the second public place I'm saying this, but, and again, it's if you say it, it will come true. There's big interest in UNICEF because we don't have a standard-setting body for the social welfare sector in particular, something like the World Health Forum. We would like to see the establishment by 2016 of some kind of world body that brings ministers of social welfare together with health or together with justice somewhere where we have a place to hold feet to fires around whatever is established in the post-2015 agenda, where we hope there is some articulation of violence prevention in children. So let me stop at that. Thank you.